and welcome. You're watching our special show, USV Save a Life. Life is very precious. The sign of being alive is the continued pumping of your heart. When your heart stops beating, you can get a cardiac emergency. A medical emergency may occur at any time to any person. As per the WHO statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. The concerning change in recent times is that the onset of heart disease is now seen at an even younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is due to the lack of awareness as to what one needs to be done when it comes to a cardiac emergency. Every adult should know which conditions qualify as heart-related or medical emergencies, and the best one can do is to learn beforehand the actions required in case of a cardiac emergency. Life-saving techniques such as CPR can in fact help you save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help us understand sudden cardiac deaths and the role of CPR to revive and save a life. To begin with, we have Dr. Sadananda, consultant interventional cardiologist and professor of cardiology and unit chief, Sri Jayadeva Institute of Cardiology and Shraddha Heart Care in Mysuru. We also have Dr. Nirav Bhalani, interventional cardiologist, founder and director, Rhythm Heart Institute in Vadodara. A very good afternoon, doctors. Let me take my first question to Dr. Sadananda. Doctor, there's a lot of misinformation about self-care that can be done during a heart attack. Can a person really help himself or herself during a heart attack? If yes, how? Dr. Sadananda.
Yeah, good afternoon. Heart attack is a medical emergency. The blood vessel supplying the heart is suddenly blocked, and the patient will experience severe chest pain, sweating, fatigue, and vomiting. And there is nothing much you can do sitting at home. The chances of survival will be maximum if the patient can reach a hospital with the cardiac ICU and cath lab within 1 hour, which is called as the golden hour. So do not waste time thinking that the chest pain may be due to gastritis. Do not panic. Relax. Avoid exerting yourself. Unlock the main door. Sit at one place. Immediately call for emergency medical help. Call for an ambulance. Call up the nearby heart hospital. Call relatives and friends who can come and help you. You can take aspirin tablet if you have one. You can either crush it or chew it. Some people and some hospitals will have what is called as a loading dose kit, which is a combination of aspirin, clopidogrel and statin tablet. So that can be taken if available before you reach the hospital. And keep your insurance papers, government health cards, emergency cash easily accessible and ready to get appropriate treatment. This is what you can do in case of a heart attack.
Right. Let me take my next question to Dr. Bhalani. Doctor, people survive a first heart attack but are at increased risk for another one. What precautions they should take in order to reduce this chance of a second heart attack? Dr. Bhalani.
Definitely. So, cardiac diseases are a lifestyle disorder. So, they cannot be cured. They can just be controlled. So, meaning that when you have a first attack, that means you are already vulnerable to have repeated such events in the future. And therefore, the most important step is to control the symptoms and control the risk factors. So, for the symptom control, you have medicines. So, the doctor who is treating your cardiac ailment would definitely prescribe you medicines, and they are the most important. And it has to be taken for a year minimum, and if needed, lifelong. And then comes risk factors. So, to prevent further episodes, the risk factors being treatment of hypertension, treatment of diabetes, obesity. Obesity is now growing a lot in India, and India is going to become again the capital of obesity by 2027-28. So you have to control obesity. Then the other risk factors being smoking and alcohol. and you have to lead a healthy life by eating healthy and doing regular exercise. The recommended would be at least 30-35 minutes of cardio.
Dr. Sadananda here to take us through some of our questions, which is that many people get confused when it comes to heart attack, cardiac arrest or heart failure. Doctor, if you can please explain their differences. Dr. Sadananda.
Yeah. Now the heart attack, cardiac arrest and heart failure, they are three different conditions. So heart attack is when the blood flow to the heart is suddenly blocked. The person has severe chest pain, sweating, vomiting. So this will need administration of clot dissolving medicines or an angioplasty to open up the blocked arteries. Whereas cardiac arrest means the heart stops beating and the person will die. And CPR is going to help in this condition. A heart failure occurs when the heart muscle doesn't pump blood as well as it should. And it is the end result of so many diseases which affects the heart. Here the patient develops breathlessness, develops swelling of the feet, severe fatigue, and decreased urine output. So to summarize, heart attack is a problem with the circulation, cardiac arrest is an electrical problem, heart failure is a problem with pumping of the heart. So these three are totally different conditions.
Right. Let me take my next question to Dr. Bhalani, who is also with us. Doctor, it is said that men are significantly more likely to have their hearts stop suddenly in comparison to women. If that's true, you could, explain that to us, Dr. Bhalani.
Definitely. So till recent times, it was known that heart diseases are a male predominance. Estrogen. So till the time a female is menstruating, the estrogen in her body protects her from having significant heart issues. But then statistically, once she stops menstruating in the postmenopausal period, her risk of getting heart diseases increases, and by the age of 60, male and female would have the same chances of having a heart attack. But now we know that this is the generation wherein women are as aggressive as men in all the fronts. They are good CEOs, they are business leaders. They also continue to smoke, and therefore the risk nowadays is also there in younger females, which was not there 15-20 years back. And therefore the idea that it is a male predominant disease is now losing its sting. So both female and male now should take care of risk factors like smoking, alcohol, should eat a healthy life, and most importantly exercise regularly.
Right, doctor, also, people aged between 30 to 40 are having heart attacks and serious heart problems. What is the main cause of a steep increase in heart problems amongst youngsters, doctor?
So basically the post-COVID has seen a lot of young patients developing heart illnesses. Secondly, the risk factors in the form of smoking, alcohol and obesity. It is said that within the next 10 years, India is going to become the key world capital of obesity and diabetes. And so diabetes and smoking affects younger people, and the obesity also affects the younger people. And because of this, the incidence of heart disease have been increasing in the younger generation.
Slipping into a very short break. Welcome back. We have our expert doctors with us. You're watching our show USV Save a Life. Dr. Arunachalam, consultant interventional cardiologist, Aruna Cardiac Care from Tirunelveli, joins us as well. A very good afternoon, doctor. If you could answer our next question, which is what are the treatment options for a heart attack? Dr. Arunachalam.
Yeah, usually heart attack means complete blockage of the blood vessel. So you have to open up the blood vessel and perfuse the myocardium muscle to make alive. So if you don't have angioplasty approachable hospital nearby, then you can give clot busters like retiplase, tenecteplase and streptokinase and transfer the patient to your hospital with cath lab facility. If cath lab facility hospital is available, you can take the patient in golden hour to primary angioplasty with stenting. And if the angiogram sometimes rarely shows multiple blocks, then such patients will be subjected to coronary artery bypass surgery. These are the three modes by which a heart attack patient is usually managed.
Right, doctor, let's talk about CPR. Does CPR apply in both conditions, whether it's cardiac arrest and also in heart attack?
Yeah, see, in what is cardiac arrest is there is no pulse and no heartbeat at all. So you have to do a cardiopulmonary resuscitation definitely. But when you take for heart attack, not all the heart attack patients require CPR. If their pulse is okay, if their blood pressure is normal, you need not do. But the heart attack patients are more at risk of developing ventricular fibrillation or pulseless ventricular tachycardia, in which case you have to do, which leads to cardiac arrest. In such cases, we need CPR and defibrillation.
Right. Let me take my next question to Dr. Bhalani. Doctor, how would a bystander, non-medical person, know if he or she is doing CPR with the right technique? What are the main steps to follow, if you could guide us?
CPR is a life-saving technique, so most of us should learn it. And nowadays there are it's excellent program started by USP, and many other NGOs have started this program wherein students and office goers and everyone is being taught CPR. So basically your idea is till the time you get medical help, either it can be ambulance with paramedical support or a nearest hospital, till that time you have to keep the patient alive by assuring proper blood supply to the brain. The patient should not be brain dead, and therefore what you have to do is you have to thump on the chest, you have to press the chest in the mid part of the sternum around 100 to 120 per minute, and they should be at least 1.5 to 2 inch. The thrust should be such forceful that the heart should be able to blood up to the brain, pump blood up to the brain, and that you should continue till you get a help from a paramedic or you reach the hospital. Statistically, more than 50% of cardiac arrest occur, and it is witnessed by a close relative, either a wife or a father or a mother or a friend. And therefore, if that wife, father, mother or a friend knows how to do a CPR, the chances of survival increases, and so CPR should be learned by each and every individual who is more than 16 years of age.
Right. So let me take the next question. Why is it so important to learn CPR for everyone? Dr. Bhalani.
So as I said, a cardiac arrest occurs in a setting like a home, in a mall setting, where you do not have a paramedic or a healthcare system available, and it is golden time is the first 30 seconds to 1 minute, wherein if the brain does not get the blood, the patient may become brain dead. And therefore, a bystander cardiac CPR, the person who is next to that gentleman, either it could be unknown person, a friend or a wife or a father, mother, if they can start timely CPR and assure that by the time paramedical help arrives, the patient can be given proper CPR, and then that patient's life can be saved. It is said that more than 50% of patients can be saved if they get a proper bystander CPR. And therefore, there is a campaign known as Each One, Teach One. Everyone should learn CPR, and then it is easy to teach a fellow colleague or a fellow friend. Each one should teach one, and everyone in India more than 16 years of age should learn the proper technique of CPR. In future, you may be able to save a life, and life is precious.
Right, doctor. Let me take my next question to Dr. Arunachalam. Sometimes due to our hectic schedules, we're not able to exercise. So does walking while doing daily chores at home or climbing the stairs at the house work as a substitute for exercise? Dr. Arunachalam.
Actually, the cardiovascular, you prevent cardiovascular disease, you must do a proper exercise. And the recommendation is we should do at least 30 to 45 minutes of brisk aerobic exercise like walking, jogging or cycling, or at least weekly twice swimming. And this has to be done at least 5 days a week, that is 5 or 7 days. And if there is another concept called work-related exercise. What it means is the labor people or the people who climb stairs or work inside the campus and all. But the thing is, even if you do the work-related exercise, for example, the amount of energy spent during your work time, but still you are recommended to do at least 20 minutes of a protocol exercise. And you also need not only the aerobic exercise, weekly twice, the 30 to 45 minutes of muscle strengthening exercise, which is very important to reduce insulin resistance if the muscles are toned, and that indirectly prevents all the complications like obesity, diabetic, hypertension, and cardiovascular diseases. So apart from the work-related activity, you need to have a protocol of at least 20 minutes of a brisk aerobic exercise in the form of walking, cycling, or jogging. Yes, Neil.
Right. Let me take my question for Dr. Sadananda now. Is it true that consuming high levels of sodium and low levels of potassium may raise our chances of a cardiovascular disease? Dr. Sadananda.
Yeah, definitely yes. A high sodium intake or salt intake and a low potassium intake, it will increase your risk of developing high blood pressure. And high blood pressure is a major risk factor for heart disease and developing stroke. And the salt intake should be less than 5 grams per day for adults. If it is less than 5 grams per day, it helps to reduce the blood pressure and helps to reduce the risk of cardiovascular disease. And unfortunately, most Indians consume about 11 grams of salt per day. And if you can reduce the sodium intake by 1 gram, you can lower the BP by 3 to 4 millimeters of mercury. In order to reduce the sodium intake, we need to avoid adding salt to the diet, avoid salted snacks and pickles. You can use salt substitutes like rock salt, which is low in sodium. You have to consume potassium-rich foods, namely fruits, vegetables, whole grains and nuts, which are rich in potassium. So taking a diet which is low in sodium, a little high in potassium, has got a lot of cardiovascular benefits. It reduces your blood pressure and indirectly helps reduce the risk of heart disease and stroke. Even in heart failure patients, we need to restrict salt and water to improve the symptoms. Therefore, salt and potassium plays a very important role in maintaining cardiovascular health. Thank you.
Right. Dr. Bhalani, does taking painkillers increase the risk of heart attack or of a stroke? Dr. Bhalani.
Yes, there was a recent study. Which said that the analysis of the study was that high dose of certain painkillers, when taken in the next 1 week period, the chances of cardiac ailments increases. So this study threw a light on the over-rampant use of over-the-counter painkillers. We know that majority of the elderly people have some or the other bone pain, some or the other joint pain, particularly knee pain, and vague myofascial pains. And because the painkiller usage is not regulated, it is easy to get it over the counter. And whenever you are taking the over-the-counter painkillers, you may get any painkiller, whether it is cardio safe or not, it is not guaranteed. And therefore, when you take certain painkillers in a larger dosage, it can cause adverse cardiac diseases. Particularly the NSAID group is not very good for the cardiac parameters. Certain painkillers can be definitely given, they are cardio safe, but then it should be under the guidance of a qualified doctor and it should not be over the counter. Also, the other side effect of this over the counter painkillers would be kidney diseases. We know that majority of the painkillers affect the kidneys, and therefore over aggressive use of over the counter NSAIDs should be avoided, and painkillers as and when required under the able guidance of a qualified medical practitioner should only be advocated.
Right. Dr. Arunachalam, I'd like to know the role diet plays in our heart functioning, and also if someone who has suffered from a heart disease, what kind of diet should they be following?
See, very important is the cardiovascular heart attack is called as a lifestyle disorder. What is very important is diet and exercise are very crucial to prevent these diseases. So what we have to do is we have to avoid high fat dense diets, energy dense diets. What we eat all in fast foods and all these things, that deep fried foods, all these things are energy dense. Especially this non-vegetarian diet should not be full fried. And you have to take a plenty of fruits, vegetables, especially green vegetables. You can take fish and you can egg white And even chicken and mutton can be taken spaced in the way of 7 to 10 days, and it should not be taken in the form of fried as much as possible. So, and apart from that, this green leafy vegetables, that's very important. And especially the big problem is you have to take at least 3 servings of fruits or vegetables per day. And even non-vegetarian diet should be avoided, preferably in the night time. And the people should take good breakfast as much possible. Breakfast should be very huge, and the afternoon lunch should be medium, and the night diet should be as light as possible. But what happens, you see, is in current era, everybody is working, and so they skip the breakfast, they take mini lunch, and they take a big dinner. That's one of the reasons for rise in cardiovascular diseases. The pattern of cooking also matters. And so the oil, if you want to take, it should be taken as a, only vegetarian should take the oils, non-vegetarian should as much restrict the oils.
Right. Thank you so much, Dr. Arunachalam, as well as Dr. Sadananda and Dr. Bhalani for joining us today on NDTV 24/7. And thank you to our viewers for your time.